The oral mucosa is pinkish in color. There's no sign of gingivitis. Can you just do like this? There's no sign of gingivitis. Okay, open your mouth. There are no sores on the mouth, on the upper hard palate also, and the soft palate. There are no sores on the tongue also. There are no sores. The teeth are all in the mouth. None is missing. Do you wear any false teeth?
No.
If the patient wear any false teeth, I will have him removed. Okay, can you also open your mouth? Stick out your tongue. Move it side to side. Okay, can you please say ah?
Ah.
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 Okay, the soft palate is able to move, and the uvula is in the middle. I will also do the gang reflex. Okay, thank you. Now, sir, I will have to examine your neck, okay? On inspection of the neck, there's no swelling of the thyroid gland, no scars on the neck, no lesions around the neck. Do you have any pain on the neck, sir?
No.
Okay. Firstly, I have to auscultate the carotid arteries. Can you please take a deep breath and hold? Just hit your head this side. Take a deep breath and hold it for me. Okay, you can breathe. Also this side, can you just face that? Take a deep breath and hold. Okay, on the carotid arteries, there are no bruises. Now I have to palpate them. Start with this one. It is brisk and tapping. On the other side, it is brisk and tapping. I can rate it in a scale of 2+. Okay, now I have to palpate the thyroid gland. Sir, can you please take a sip of this water and do not swallow it? Okay. Right behind from the patient. Sorry, my hands are cold. Can you please swallow? Okay. Now, just plate. There is no swelling of the thyroid gland. It is not palpable. The lobes are not palpable. Thank you. And now I have to palpate the lymph nodes. Firstly, the pre-auricular lymph nodes, the post-auricular, the occipital nodes, the tonsillar, submandibular, the submental, the artificial cervical, the posterior cervical, the deep cervical chain. Can you please shrunk your shoulder like this? Not that much, okay. Sure. The supraclavicle, okay, you can relax. The infraclavicle. Also, I have to the epitrochlear nodes, the lateral nodes, the anterior axilla, the posterior axilla, and the central axilla. Also on this side, the epitrochlear and lateral axilla, anterior axilla, and the posterior axilla, and the central also. There are no palpable lymph nodes all over. Okay, sir. Can you please touch your shoulders with your chin? On the other side. Okay, your chest. Okay, move it up. There's a full range of motion of the neck. Now I'll test the strength. Can you please face that side against my resistance? Okay, that other side. Okay, can you shrink your shoulders like against my resistance? Okay, thank you. The strength, I can read it 5 plus, and the accessory nerve is intact, which supplies the sternocleidomastoid muscles. So now I have to examine your chest, your thorax. Okay, I will start with the posterior one. On inspection of the posterior chest, the skin color is homogeneous. There are no scars, no lesions, and the chest looks symmetrical. There are no deformities. Can you take a deep breath for me, in and out? Okay, thank you. Do you have any pain in your back? No. Okay, I have to palpate now. Also, the spinal processes are in the midline. Tell me if you feel any pain. No tenderness on palpation. Okay, I'm going to do the chest expansion. Can you please breathe in and out? In. Okay. The chest expansion is symmetrical. Now I have two parts. Can you please fold your arms in your chest? Yes, thank you. To move the scapula out of the way. Side to side. Okay, thank you. There's resonant sound all over the lung fields. Sir, now I'll have to listen to your lungs, okay?
Okay.
With the diaphragm of my stethoscope. Can you please breathe in and out with your mouth open as I place my stethoscope, okay?
Okay.
Continue folding your arms. There's good air entry. There are no adventitious sounds. If I had any transmitted sound, I would have to do the special test for echophony, bronchophony, or whispered pectoraloquy. But now I have to do the echophony one only. So can you please just say E as I place the stethoscope over you?
E, 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 E.
Okay, thank you. The sounds are heard clearly. The E's are heard as E's, not as R. Okay, thank you. Now I have to do the anterior chest. Also, on inspection, there are no hair distribution. The skin color is even, and no scars, no lesions. Can you please take a deep breath in and out? Okay, there are no deformities of the chest. The chest looks symmetrical. Do you have any pain in your anterior chest? Okay. I have to palpate. Tell me if you feel any pain. Just there now. Okay, no pain and palpation. Okay, now I have to percuss. There's resonant sound all over the lung fields. Now I have to auscultate. You can also breathe with your mouth open in and out as I place the stethoscope. There is good air entry and there are no adventitious sounds heard. I will also, if I had any transmitted sound, I had to do egophony, bronchophony, and whispered pectoral guai. But now I have to do the bronchophony. Can you please say 99 as I place the stethoscope?
99, 99, 99, 99, 99. 99.
The sounds, they are clear, they are heard 99, they are soft and muffled. Okay, thank you, sir. Now I have to examine the upper extremities, okay? Firstly, on inspection of the joints, the shoulder joint, they look symmetrical, there's no redness, no swellings. Can you just put also in the elbows, there are no swellings, no redness. Also on the wrist, they look symmetrical. Also in the fingers and the thumbs. Can you just do like this? Also in the back of the elbow, no swellings and redness. Do you have any joint pains? Okay. Now I have to palpate the joints. Firstly, following the clavicle, tell me if you feel any pain. Also here, no pain. Great tubercle. Okay. Just bending. Okay. No pain. Anachronon process. Okay, no pain. On the wrist. Swelling. Okay, so let's feel the temperature of the joints. Okay, on palpation there is no crepitus, no tenderness, no masses, no swelling, and the temperature bilaterally is warm of the joint. Okay, now we have to do the range of motion. Can you just stand for me, please? Do as I do. We abduct the shoulder, we adduct the shoulder, forward flexion, backward flexion. Can you touch the scapula on the opposite side with one hand? The scapula. Okay. Internal rotation with the other hand. Internal rotation, can you do like this? External rotation. Can you do like this? pronation, supination. Can you flex like this? Flexion of the wrist, extension of the wrist. Can you do like this? Flexion of the elbow, extension of the elbow. Can we do like this? Abduction of the fingers, put them close together. Abduction. Can you just move away? Radial deviation, ulnar deviation. Okay, thank you. Can you just touch? Okay, thank you. There is full range of motion of the upper extremities. Now we have to test for strength. Okay, can you just do like this for me? Don't allow me to pull you this side, okay? Abduction, abduction. I'll send this side. Abduction, abduction, strength. Okay. Also keep your hands, yeah, don't allow me to pull you down. Okay. Don't allow me to pull you up. Okay, thank you. Do like this. Don't allow me to pull you. Like, yeah, the arms. Thank you. Don't allow me to push you. Thank you. Can you do like this? Don't allow me to pull you down. Don't allow me to push you up. Can you do like this for me? Don't allow me to put your fingers close together. Okay, thank you. Try to touch this small finger against my resistance on chassis. Okay, try to touch it. Okay, the other side. Muscle strength of the upper extremities is 5+. Okay, thank you. You can sit down. Now, sir, I'm going to examine your heart. Okay. I'll ask you to lie supine on the bed. I have to elevate the bed to an angle of 30 degrees and have with my pen light. Okay, first I will inspect the JVP, jugular vein pulsation. Can you please surface that side? I can see the jugular vein pulsation above the clavicle, up to the halfway to this master process. Okay, can you face this side? Also this side, I can see the jugular vein pulsation right up to the angle of the mandible. Okay, now we're going to inspect the precordium. I can see the pulsation. There are no gallops. Okay. So do you have any pain in your heart? Okay. Now I have to palpate the precordium. I have to palpate the precordium for any lifts, any trills. And the apical impulse. Okay, the apical impulse is palpable in the left mid-clavicular line in the 5th intercostal space. It is brisk and tapping in a diameter of less than 2 centimeters. Okay. Now I have to auscultate. First, using the bell of my stethoscope, starting from the aortic area. Breathe in deeply, slowly. The pulmonary area, Epps point, the tricuspid area, and the mitral area. Also, I have to change and listen with the bell of the stethoscope. Also, breathe in deeply, softly. Aortic area, pulmonary area, the Epps point, tricuspid area, then the mitral area. There are no murmurs heard, no extra heart sound. S1 is louder at the apex, S2 is louder at the base. And the split of A1 and S2 is higher than the EPS point. Okay. Now, sir, I have to examine your abdomen, okay? With my patient supine and the bed flat, on inspection, just keep your hands, yes, next to your hips. There's slightly hair distribution on the abdomen with the umbilicus inverted. There are no scars, no lesion on the abdomen, and the contour of the abdomen is flat. Said, do you have any pain in your abdomen?
No.
Before I palpate, I have to listen with the diaphragm in all the 4 quadrants for any bowel sounds. Suprapubic area. Bowel sounds are present and they are hypoactive. I also have to listen to the aorta and the renal arteries for any bruise. There are no bruise on the abdominal aorta and the renal arteries. Now I have to percuss. Please tell me if you will feel any pain during the percussion, okay? Also on the suprapubic area. On percussion, tympanic sound is heard all over the 4th quadrant, also in the suprapubic, also in the epigastric. There is no tenderness. Now I have to do the liver span. My pen.